Today, millions of people struggle to access health care in Arizona and across the country. For many, things like scheduling a doctor's visit for a seasonal cold or calling in for a prescription refill are simply out of reach.
They're working minimum wage jobs, they're just barely making it, and healthcare is just not part of their budget.
You know, between the prescriptions, the doctor visits, the co-pays, it's too much.
I didn't know where to turn. I exhausted all the resources that were given to me. I just felt hopeless.
Our healthcare system is in the midst of a major transition. Although the changes will eventually provide more people with access to care, in Arizona, an estimated 1 million people will always uninsured. uninsured.
Most individuals think Affordable Health Care Act is about healthcare insurance. It's much more than that. It's about providing quality care. It's about providing preventive services. It's about engaging the community. And I think Mission of Mercy will always have a space and place as it relates to the health of our community.
Since 1997, one organization has found a way to bring the doctor to the people, providing a medical home for thousands of people who would otherwise have nowhere else to go.
When people come to Mission of Mercy, traditionally it's their last resort. Many of them don't know where else to go. They got a referral from someplace, somewhere, someone said, go here.
What I love about Mission of Mercy is that they are able to provide medical care for many, many patients who never would have any medical care due to their lack of resources.
We bring obviously a lot of years of experience, good, sound clinical judgment, and in return for that, we again get the gratification and the satisfaction of treating patients.
Through partnerships with community and faith centers that serve as host sites, they're able to operate free primary health clinics across Maricopa County.
For our church, working with Mission of Mercy is just a very natural partnership. We preach God's love, we teach God's love, we tell people about God's love, but we don't want to just talk about it. We want to show people God's love.
It's a resource that strengthens our community.
We know that we're referring students, families, community, and sometimes even staff members to Mission of Mercy so they can be healthy, so they can be successful, and so they can be at school.
It's more than medicine. Their mission is healing through love and the restoration of dignity, sharing God's love and meeting people where they're at in life with only one question: how can we help?
We're doing more than just offering health care. We're restoring people's dignity. They leave feeling good about themselves. They're not, oh, I had to come in for free health care and I feel bad. They're leaving with a smile on their face. They've been treated like people.
Once they see that your intentions are definitely in their best interest, they can relax, they have confidence in you, and they're more compliant in doing what you ask them to do.
You know, everyone that lives in the community require basic needs of life. We need food and shelter, but more importantly, we deserve to have dignity. And I think Mission of Mercy exemplifies that.
Meet Maria. She suffers from a blood disorder, requiring expensive medications to manage her red blood count.
She has a condition called thrombocytosis, which means that she has too many platelets in her blood and makes her at risk for having a stroke.
Although she works full-time, her job does not provide medical benefits. The cost of the prescriptions, co-pays, and regular labs were too expensive.
If you can't get to medication at a reasonable price, you know, people go without it, and I had to go without it because I couldn't afford the medication.
While confiding in a friend about her situation, she learned about a place where she might be able to see a doctor and find help.
My coworker at work She had heard me talking about how I needed my medication, that I was off my medication for so long, that I so desperately needed to lower my platelets. And she had mentioned Mission of Mercy. I didn't know if they would be able to assist me, being my blood disorder, being the way it was.
She had been seeing a private hematologist, but since she had no insurance, she was unable to afford the visit, and that's why she came here, so we could attempt to get her medicine.
When I was at Mission of Mercy, the doctor had requested all kinds of lab work. I didn't know how or what the charge was going to be. Come to realize there was no cost to me.
For now, Mission of Mercy will serve as Maria's medical home, providing her with the ongoing care she will need to remain healthy.
It was just a blessing. I mean, it's just been a blessing all the way around, and I am so grateful to Mission of Mercy. I'm so grateful to the doctors, to the staff, to have helped me the way they do.
People turn to Mission of Mercy for a variety of reasons. For some, the clinic is a medical home during a time of transition, perhaps between jobs or while waiting for medical benefits to kick in. Meet Tony and her family. Her children were covered under the Arizona's Kids Care program until they lost coverage.
We had to wait 6 months until we could get them covered under my husband's company's insurance. My daughter was diagnosed with hypothyroid disease about 1.5 years ago. We noticed because she had very low energy and started gaining a lot of weight and was having headaches and just wasn't being a normal child. I heard about Mission of Mercy through the school nurse. My daughter was actually not feeling well because she hadn't had her thyroid medication in a few days. And she told that to the nurse, and the nurse gave me a call and recommended that we take her into Mission of Mercy to see if we could get medication.
Mission of Mercy referred Leah to Sonora Quest Laboratories for her annual lab work and refilled her prescription.
Referring us to Sonora Quest, getting free labs to make sure that the medication they were prescribing her was right, and then referring us to a low-cost endocrinologist, that was above and beyond what I expected.
2 weeks later, all 3 children were added to their father's health insurance. Tony shares that she felt relieved knowing that Mission of Mercy was there for her family.
It was a relief knowing that there was a place we could go when we were not covered, and knowing that there were doctors there volunteering their time, willing to help out people like us. It was amazing. It was.
While there are many things we don't know about the future of healthcare, there will always be those who need a helping hand and a safe medical home.
There are always, always, always going to be people that are going to need health care. And I think Mission of Mercy is that place where they're going to receive that free health care.
This is not just a clinic. These are their doctors. These are people that they know. And this is their primary health care. This is where they turn to when they have a need.
It was above and beyond what we could have ever expected, and we are very grateful for Mission of Mercy helping our daughter.
Everybody there is there to help everyone, and they're all doing God's work there.
And for them, Mission of Mercy will be there to fill that gap and to serve as an example of what is possible when people come together to help each other and share God's healing love.